Hey, good morning, everyone. Aloha. Welcome to the Wednesday edition of the COVID Care Conversation. Is it Wednesday, Ryan? The days all start to blend together. Good morning. I'm Yunji Denise.
And I'm Ryan Kalei Suji. All we know is that we are here every day at 10 o'clock here on the Honolulu Star Advertiser Facebook page. And I want to thank all of you for tuning in and for being a part of this very important conversation. Again, we are here. We've been here for the past week and a half now, sort of giving you information about this COVID-19 pandemic, how it's impacting our state, and connecting you with resources. And our hope is that we can provide this platform as a way for you to engage with one another, ask questions, as well as keep you informed of things that are happening here, but also things that are happening all over the world and how everyone is dealing with this coronavirus.
Yeah, let us know where you're watching from this morning, and aloha and good morning to Gail. To ask you to ask questions for ABC News is Andrea Fujii. She's a local girl who now lives and reports in New York. They are, of course, the epicenter of this crisis. So what can we learn from them? We're really excited to have her on this morning. The New York is just really in a tough spot. You actually see triage centers and field hospitals being opened in the middle of Central Park. Just incredible to see. Before we get to her, though, we always begin the morning with the latest count.
That's right. So as of yesterday, when the state released their latest numbers, Hawaii had 20 new cases up from Monday, with a total of now 224 cases. Most significantly, Hawaii reported its first COVID-19 related death here in Hawaii, and that was an older man from Oahu who had multiple health issues. But a significant day in that Hawaii saw its first victim, so to speak, of this COVID-19. Also, I mean, just to go back as well, the state had initially reported that we had a death last week, but actually retracted that after they went back and reviewed some of the results to determine that it wasn't related. This one, however, that was reported yesterday is actually confirmed. So those cases, again, we're continuing to see rise, 224 confirmed cases here in Hawaii.
Of course, our numbers pale in comparison to those in New York, and we want to bring on Andrea Fujii, as we told you. She hails from here in Hawaii, but now lives and works in New York. Thank you so much for being here this morning, Andrea. We are a little limited in our technology, but we are so happy to have you. And we even see that your sister, Erin, is watching from Long Beach. So good morning.
I know, I see that. Hello, Yunji and Ryan, and hello, Erin in Long Beach. My parents in Manoa who are watching as well. Thanks for having me on, and sorry we have to talk about this very grim topic.
Yeah, so give us a snapshot of what's happening where you are.
So here in New York, you mentioned, Yunji, we are the epicenter of the number of COVID-19 cases. We lead the nation in the city. New York City alone has more than 45,000 cases. And more than 1,000 people in the city alone have died from COVID-19. And I believe that I heard a statistic, it's every 6 minutes or so, someone dies in the city from COVID-19. It kind of puts it all into perspective.
Wow, that is just incredible. You are now further along than us in your lockdown. Tell us about the day-to-day. What is life like for New Yorkers who are just trying to make it through?
It's tough. It's tough. And we are now in our third week of no school, and about 2 weeks into non-essential workers being told to stay at home. Now, I'm in TV news. My husband's in TV news, so we are essential workers, as you guys are as well. But I have a letter and my husband does too. You have to carry this around with you if you're going to work, because if you get stopped, you need to show this to authorities saying, I'm an essential worker, I'm okay to be out and about. Because of social distancing, they really want to make sure these rules are followed. And right now in New York City, because most people are following social distancing rules, but there are those outliers who, for whatever reason, still are gathering in groups. And the mayor has just announced a couple of days ago that if you don't follow those rules, there are fines of up to $500 for people who are not social distancing.
You know, Andrea, you mentioned your husband, of course, is Whit Johnson, who is, we see on Good Morning America, on World News Tonight, on ABC. He's sort of in the front lines there. What sort of things has he shared, and what are some of the things that maybe you've seen as well, reporting, but what are some of the things that are seeing and are happening on the front lines there?
Yes, you're right. He is on the front lines. He has to go into work into the city 5 days a week at least. So he is out and about reporting on coronavirus at least 3 days a week. And, he tries to be as careful as he can. He finally started taking a mask with him. And he wears gloves whenever he can. I mean, just the other day, he was doing a live shot outside of Elmhurst Hospital in Queens, which is a hospital that is getting a surge of patients. And he was standing in front of, a good 20, 30 feet away, but standing in front of a long line of people trying to get into the hospital just to get tested. So, of course, these doctors and nurses and medical workers are putting themselves in danger, but journalists too are out there as well, and it's dangerous for them as well. So, luckily I can work from home. I work for ABC News as well, but just a couple days a week because now I have another full-time job, which is teaching my kids because we have no school. But yeah, it's been life-changing, but it's our new normal for the foreseeable future for sure.
And I know that even in your own circumstance, you had to self-quarantine. Can you tell us a little bit about that?
Yeah. So, Whit, my husband, has interviewed many people on this story, and now you're seeing a lot more Skype interviews because people are not interviewing people face to face as much anymore. But before all that happened, he was interviewing people in person, and we got notice that one of the people he did interview a few days later tested positive. So because of that, we as a family had to self-quarantine for that 14 days stretch. We weren't quarantined for 14 days, but by the time we heard that person tested positive, we marked it out and stayed home for a number of days just to make sure for 2 weeks. We had to monitor symptoms, and luckily we did not have any. We're completely healthy. But yeah, we had to stay in our house and not even leave to go exercise. So that was a bit tough, but luckily we're fine. We're good.
New York has really become the epicenter of this pandemic. And, maybe if you can share with us how the city has changed. I mean, from a physical standpoint, things are being converted on that end. And overall, just what does it feel like, I guess, to be in the midst of all of that?
Well, it doesn't feel good to be kind of an example for the rest of the country in this because New York really has been hit so hard, and we know that it's going to be a ripple effect for the rest of the country. So other states are kind of looking to see how we handle it because they know they are going to be hit with it next, this onslaught of cases and deaths. But the city, I haven't been to the city for about 2 to 3 weeks, but even when I took the train in 2 weeks ago, it was it was much more empty than it normally is. I mean, if you've been to Grand Central Station, you know how crowded it is, no matter what day, no matter what time. But even 2 weeks ago, there were only a few dozen people at Grand Central Station. And now I've seen pictures, and there are only a handful of people at Grand Central. And that just goes to show how much has changed and how people are really taking these social distancing rules seriously. But yes, you were mentioning Central Park. There is now a makeshift hospital there for COVID-19 patients. I mean, imagine, that sprawling Grand Central Park, beautiful, and then, there's a hospital right in the middle of it. And also the USNS Comfort is also in New York City now, taking on patients who do not have COVID-19, trying to relieve the hospital system of some of these other patients. The US Open Tennis Center in Queens is also now converted into a hospital. They will be taking patients as well. So many changes. The streets of New York City, for the most part, are completely empty. It's just, I mean, it's very strange to see and hear these stories. Here, we live in Westchester County, so we are about 45 minutes north, a 45-minute north drive. But we here in the burbs, taking it very seriously as well. It's eerie to see our streets pretty much empty.
I think a lot of us are looking at New York and seeing what can we learn from that. Hawaii, we've had our first death yesterday. You're talking about a death every 6 minutes or so. What would you tell folks here about the importance of social distancing and why we really need to do that right now?
Well, the glimmer of hope that New Yorkers are seeing is hospitalizations are starting to dip slightly. Now that could just be for a limited amount of time, but whatever it is, we are taking that as a glimmer of hope. And what that shows is social distancing does work. I mean, we saw that in China, we saw that in Italy. These numbers are going down and it does work. It might take a little bit of time to get there, but the fact that you're not seeing people gathering and this virus then is not spreading as quickly. So that is, we've heard it time and time again, just stay home, and we can see that it does work.
And we also know that you are a mother of two, trying to raise your daughters in the midst of this. A lot of parents also dealing with similar circumstances with now they're being forced to sort of be parent and teacher. What has that been like for you to sort of navigate through?
Well, I have a second grader and a kindergartner, and the kindergartner's attention span is like that big. So, I have to constantly be monitoring her as far as her homework goes. But luckily, I'm so glad that I just work part-time that I can do this and I can stay home with them and make sure they're learning. It's hard though, as parents. I mean, many of us can relate. I'm on so many text chains with other frustrated moms trying to figure out how to make sure that our kids are learning and these last few months of school doesn't go to waste. But it is trying for sure. My patience is completely tested, and we're so grateful for teachers. We know what they go through every day. And for the parents who are just starting this, the connection to school and friends is so important for our kids. And so what we've done is we make sure that our kids do FaceTime calls with their friends. Even our kindergartner, she did her first FaceTime call with another friend the other day. And, it's hilarious to watch because there's a lot of silence that goes on. There's a lot of hide and go seek with the camera. But that physical or that connection to try to act like they're being physically connected to their friends is so important.
Robert Lamb has a good point here. Seeing what's going on with New York is like seeing into the future of sorts. I know that you are a busy woman and you have to go soon, but just lastly, what would you tell people in Hawaii? What's your message to us from the future, if you will?
Trying to see the glimmer of hope in everything and trying to see the helpers. We see so much grim news going on, so many sad statistics, but the good in people really comes out in these trying times as well. I mean, New York City, I think it's every night now, people pop their heads out and pop their hands out of their apartment windows and clap and sing and cheer on the medical workers at 7 p.m. almost every night. Lots of people are making masks for those medical workers. There's just a lot of good that we try to hang our hats on here in New York just to make ourselves feel better and focus on the good. But like we said, the social distancing really helps. Taking this just seriously really helps, and we will get through this all together.
Well, Andrea, thank you so much for taking time out of your schedule, and we continue to send you the best wishes to you, Whit, and the entire family. But appreciate you taking time to be with us here today. Thanks.
Thanks for having me. Hope to talk to you guys again.
Thank you. Well, there you hear, 1,000 people already dead in New York City alone. If you think about that compared to our one yesterday, we really do need to take her lessons to heart that social distancing is so important. We do want to talk about some other headlines and also tell you about tomorrow back here at home. We're going to have the spokeswoman for the emergency medical services, Shane Enright, is going to be on here. She also is the spokeswoman for ocean safety. So she's going to answer all of our questions about ocean safety and their role, and of course, how we can help our paramedics. Before we get to that, though, we do want to talk about Kauai. Kauai police made their first arrest here in Hawaii. We'd love to know what you guys think about this. This is a visitor who was arrested, 62-year-old Tampa man who was staying in Kapa'a at a hotel. He was stopped in Hanalei and arrested. He's been charged with a misdemeanor. He has his first court appearance, I believe, later this week. So love to hear what you think about the state now deciding to arrest visitors who are violating that quarantine. We do see some actual enforcement, which I know folks were pretty worried about.
Yeah, and I think it's actually, in some regards, it's good to see that police are really trying to help and enforce this 14-day quarantine and trying to make sure that these guests and these tourists and these visitors that are coming to the islands are taking that seriously. I know that starting today, in fact, some of the members of the Hawaii Tourism Authority are actually going to begin those calls to check in on those visitors that have come to the islands and that had listed their numbers down. That will start happening today, and making sure that these people who are visiting are in fact where they said they will be. A lot of people there's a lot of discussion over how do we maybe create a different types of system, not only just by phone call, but if there's something else that can be developed to really monitor and make sure that this 14-day quarantine is actually being upheld, and also happening. I believe today's Wednesday, right? Also
Yes.
happening today is the mandatory quarantine for those who travel now inter-island. That is also in effect. That happened as of today. Anyone traveling between the neighbor islands will have to undergo that same 14-day quarantine.
Yeah, that's the Star Advertiser's big question today. What do you think of that mandatory 14-day inter-island travel quarantine? That's for residents and visitors alike. So very interesting. And of course, as Ryan noted, it is Wednesday, so the bus is going to start running on a holiday schedule today. All private clubs like golf courses and tennis clubs are being asked to close. And yesterday, Mayor Kirk Caldwell, as he did when he talked with us on Monday, and we are going to have him back because we know that you guys really like being able to interface with him, he is asking the president to stop all commercial flights to Hawaii. So we'd love to know what you think about that. Very interesting call from the mayor there. So we see that Brenda is really wanting us to talk about unemployment application. We were so lucky to have Scott Murakami on yesterday. Thank you so much for all of those folks who asked questions. Go back and watch that video if you happen to miss it, because he covers a lot of ground, and we're going to try to have him on again in the future because we know a lot of you are filing those claims for the first time. Yeah,
the challenging part is that there are so many components to this coronavirus pandemic, and there's multiple layers from visitor arrivals to unemployment to just health tips that can also be addressed. So we're trying to do as much as we can and cover as much topics as we can. And again, that was a great one to look back on. We also want to have Scott, Director Murakami, back on here, hopefully to answer more questions, because we know that is something that a lot of people are trying to navigate through during this time as well. Brandon says he wants to hear from Dr. Green and Dr. Rupi. Well, you're in luck because on Monday, Dr. Rupi will be joining us. The doctor will be in. So save your medical questions for her. We'd love to hear what you want to ask her. She had some great tips. We had her on over the weekend, but we'll definitely bring her back on Monday. We also want to talk to you about Hawaii Heroes. Of course, this is not just all doom and gloom. There are some glimmers of hope. As Andrea noted, our Hawaii hero of the day is Kohana Hawaiian Agricole Rum. They've joined a growing list of local companies who are making and donating alcohol-based hand sanitizers. That's for healthcare workers, the elderly, homeless, all those folks who are performing essential services in food, and also in our education environments and in the prisons. So wonderful to see that they've turned their rum making facility into a hand sanitizer facility. This stuff is not for sale. They're actually donating it. The paper has a great write-up of that today. So we want to tip of the hat to them. Yeah, and again, we're seeing a lot of these businesses sort of diversify, if you will, and trying to find ways in which they can provide support. So great to see their help out there. And again, we know that there is a lot of things that are happening, good happening in the community. So we encourage you to send in any suggestions or anything that you're seeing out there that really highlight how we are doing and how people are really helping to keep us safe, but also to keep our spirits lifted as well. We also know that there is a need for testing. More people want to get tested. There is what they believe to be community spread. It was very interesting. Dr. Bruce Anderson said, they've been testing those flu samples, and they found their first positive result in those flu samples. So that person was tested for flu, not for COVID, but they went back and retested those. So they know that there is community spread, at least on Oahu, where that positive one was found. So if you think that you need to have testing done, the Queens Medical Center has a call center. The number is 691-2619. You see it right there. You can call. It's staffed with a nurse. And that person will take questions and actually has the ability to write a prescription for a drive-through test. So of course, talk to your primary care provider if you have that relationship. If you don't, or if you just have very specific COVID questions, you can call the Queen's hotline. They can help you. That is a wonderful resource. Again, 691-2619.
2619.
Also yesterday, we heard in the press conference between the mayor and HPD Police Chief Susan Ballard, they talked more about the citations that were being handed out and the way in which they're going about doing that. One of the things that she did stress is that they are handing out warnings first. And so a total of 1,500 warnings were actually handed out, and 180 citations for emergency law violations were also made during that time. And there were 9 arrests under, sort of these orders to promote this social distancing during this overall pandemic. So a lot of that were related to park closures, and a lot of that, again, she also mentioned that because the roads are so clear now, like a lot of people maybe are not used to seeing the freeway so wide open, and speeding has become an issue. And so that was one of their things that they really wanted to stress, is that the public continues to remain safe. And while they are allowing people, of course, to go to the markets and to grab essentials, they really don't want anyone taking advantage of that, and really being mindful of the rules. So and again, if you have questions about park closures, what you're allowed, what you're not allowed to do as well, the city actually has a website they have set up as well called One Oahu. And you can also go to that site to get more information, or you can go back and watch our interview with Honolulu Mayor Kirk Caldwell, who spoke directly about access to the beach, what you are allowed to do, how they are trying to enforce some of these park regulations, and how you can sort of be able to live somewhat of a life outside without being in violation of some of those parameters that they've set in place.
Yeah, bottom line, of course, stay home as much as you can. The faster that we do this, the faster we can all get back to normal. And thank you, Lloyd. He says that Andrea was fabulous. Please have her on again. Hopefully the next time we have her on, there is better news to report. Just a staggering statistic to think about someone dying every 6 minutes in New York. When you start to really think about that, it really, gives you chills.
And I think one of the important things that we have to remember, and one of the things that was mentioned by a viewer, is looking at some of these other states and how they're doing it. We've heard from public officials here saying how they are in direct contact with the other states and with the other governors to make sure that we are sort of heeding the warnings, and that we are implementing the best practices that we can here in Hawaii to prevent something like what is happening and what we're seeing in some of these major cities happen here. One of the areas of concern by officials is the fact of, especially here in Honolulu on the island of Oahu, is the dense population that we have here, and how close everyone sort of is to one another, which is often leads to those higher numbers. We're seeing that in some of those bigger cities. So we can learn a lot from what is happening in these other communities and in these other cities. And I think that's why it's so important to sort of have that conversation, knowing what is happening in other locations. Prior to my job here and working in the media field, I actually worked for the administration for governor. And one of the things that happens all the time is in these sorts of national crises is they have these conference calls between all of the governors and someone from the administration. So whether it be the president himself, the chief of staff, the vice president, and those calls are a way to sort of engage all the states to kind of say what they need, what resources they need. And we know that that's happening right here with a lot of states requesting specific things. We heard Governor Cuomo from New York saying yesterday that it's almost like being on eBay, where you're competing with 50 other states for certain things and trying to outbuy each other just because of the demand for all these supplies are in such high need right now.
Yeah, so we want to limit our needs, and we do that by staying home. And we thank all of you who are doing that. If you are interested in helping out right now, maybe you want to sew some masks, or you have something to donate, or you have some specific skills, or you're a business and you need help, we encourage you to go to coronavirushawaii.com. That's a website dedicated to all things related to what's happening with the virus, and also to making those critical connections here on our own community, linking volunteers with businesses and organizations that need help.
Yeah, there's a lot of need that's happening right now. And of course, we also have a lot of useful links on the staradvertiser.com on the website of the paper itself. You can actually sign up for specific alerts as well if you're not getting these alerts, to just kind of stay updated with totals, numbers, any breaking news that happens. It's a great resource, of course, to sort of stay engaged with what's happening. We're seeing almost daily press conferences now with updates and those figures. I think another important note that was made yesterday in the press conference was Lieutenant Governor Josh Green mentioning that a lot of the numbers that we're seeing this week are based off of what was taking place last week. And so those numbers he's saying are going to continue to rise this week, that we're going to see those increases in cases. But the real test might be next week, once we sort of have this stay-at-home period really to assess if it's working. And hopefully that we'll see next week and the week after that those numbers will slowly begin coming down, because the testing is sort of a week behind from the numbers that we are seeing here that are released every day.
Yeah, that's right, because it takes 3 to 5 days to get those test results back. Okay, so tomorrow, again, we're going to have Shane Enright from EMS and Ocean Safety on. She's going to talk specifically about the paramedics and the situation that they are facing. We want to hear your questions for her. And then Friday, we'll have Sarah Sarkis. She is a psychologist. This is obviously taking a huge mental toll on all of us. So what can we do? We're really excited to have her on. This is sort of an Ask the Doctor, but we're focusing specifically on mental health, because we all know that we are feeling a little stressed right now. Then Monday, it's Dr. Rupi. And after that, we're going to continue to schedule our guests. We're going to try to have the mayor back on. Clearly, plenty of you want to hear more from Scott Murakami, so we'll try to get him back, and let us know who else you would like to hear from. This, of course, is your forum to talk to us and to really talk to each other, because we know that in this time of isolation, we really could use some community, and that's why we are here. We, of course, thank our partners at the Hawaii Executive Committee. They are a consortium of, Hawaii Executive Collaboration. They are a consortium of business and civic leaders who are working to make Hawaii a better place, and they're our partners in this endeavor, so we thank them. And of course, Star Advertiser has a wonderful section on their website devoted entirely to all things coronavirus, so make sure you check that for closures and all news updates.
And that's right. And again, we ask you to continue to comment on this even after this live feed ends, because we will check back on here. So if there are specific questions that you have about something and you would like to hear from somebody, again, we would love your recommendations to find people that you want to connect with and information that you need. So a great resource is in this comment section where you can continue to provide your input and feedback. But until then, we will see you back here tomorrow at 10 a.m. here on the Star Advertiser Facebook page. Aloha.
Aloha.